Hello, everyone. I'm Dr. Lara Wittine, a board-certified sleep medicine specialist. And we all know that ischemic heart disease is the number one killer of men and women in the United States. Therefore, when people present with classic ischemic chest pain symptoms, such as an elephant is sitting on my chest, we get concerned and immediately start working up them for life-threatening ischemia and try to identify risk factors. Now, there is one risk factor for cardiovascular disease that oftentimes patients may be unaware of or will not bring to people's attention, and therefore practitioners are sometimes less likely to address it. I want to be able to talk to you about this and bring it to light in a case presentation. A patient, a 65-year-old man who was in relatively good health aside from hypertension, went to visit his son and help him with different things around his brand new home. And the day went well, and then in the evening hours as they were bedding down, the father mentions to the son, "Hey, if I call out for you at night, please call 911. I think I may be having a stroke or heart attack." Well, this alarms the son. You're like, where did this come from? And apparently, the father over the last month had either been waking up with a sensation of an elephant sitting on his chest, or he had that sensation during the course of the night. That or very striking, profound headaches. So this alarmed the son. He wasn't going to wait for something to happen, and he brought him to the emergency room, and a workup ensued that included troponins, EKG, a stress echocardiogram, carotid Dopplers, calcium imaging, and everything came back normal. Now, if you were the internist, are you reassured that these symptoms are not cardiac related in the least? Well, luckily, the intern who was taking care of him was suspicious, especially with the clustering of these events at night and in the early morning hours. And he screened the patient with a stop-bang questionnaire that came back elevated, suggestive of a high risk of obstructive sleep apnea. Sleep testing actually did show that the patient had severe sleep apnea, meaning that the patient would either stop breathing or not breathe well enough to maintain oxygen levels at least 30 times each hour. In fact, this patient would have apneic spells that lasted up to 2 minutes. Can you imagine holding your breath for 2 minutes repetitively during the course of a night? So oxygen levels dropped to 32% during these episodes, and that actually triggered ischemic symptoms during the night. And we know this because as soon as the patient started on CPAP therapy, he never had that sensation in his chest or in his head again. In fact, autopat therapy was very successful at normalizing his apnea-hypopnea index less than 5. Just so that you know, cardiac arrest or death during sleep is linked to obstructive sleep apnea. In fact, patients with untreated sleep apnea are twice as likely to have heart attacks than those who do not. Obstructive sleep apnea causes cyclic drops in oxygen levels, as well as intrathoracic pressure changes and catecholamine surges that can increase the risk of cardiovascular disease. That's why the American Heart Association recommends increased screening and awareness of obstructive sleep apnea in those at risk for cardiovascular disease. So please, I hope this case highlights for all of you that if you have a patient that has cardiovascular risk factors, cardiovascular disease, or is complaining of symptoms of heart disease, then please ask them some simple questions. Do you snore? Do you stop breathing at night? Do you gasp yourself or choke yourself awake at night? Do you wake up feeling refreshed? Do you have headaches in the morning? Are you excessively sleepy during the day? And screen them with a stop-bang questionnaire. That might unearth a very significant risk factor that is absolutely treatable and can help reduce cardiovascular risk and death. Thank you.